Welcome to Clinicals with PHARM VIC. Today we will be learning about medications, in particular Abacavir. Abacavir is also known as ABC. It belongs to a class called nucleoside reverse transcriptase inhibitors. The active phosphorylated Abacavir metabolites inhibit viral reverse transcriptase and viral DNA synthesis, preventing HIV replication. The specific site of action differs for each drug. These differences are exploited in combination regimens. Abacavir is indicated for HIV infection, used with other antiretrovirals in combination regimens. It's also used for prophylaxis during pregnancy to prevent vertical transmission of HIV and for prophylaxis after exposure to HIV. If the patient has hypersensitivity to Abacavir, it is contraindicated. This includes patients with the HLA-B*5701 allele. Testing for this allele before prescribing is crucial, and if positive, it should be recorded as an allergy. Risk factors for cardiovascular disease should be considered, as some data suggest an increased risk of MI, though an FDA meta-analysis did not show this. Hereditary fructose intolerance is also a precaution, as Abacavir oral liquid contains sorbitol. Abacavir is mainly hepatically metabolized. The dose should be reduced in mild impairment and used with caution in moderate to severe hepatic impairment. It is contraindicated if there are serious adverse reactions or raised aminotransferases at the start of treatment. Other risk factors like chronic hepatitis B or C increase the risk of hepatotoxicity, and severe impairment may increase adverse effects. For children, specialist advice should be sought. During pregnancy, combination antiretroviral treatment is used to reduce perinatal HIV transmission. Strategies to reduce vertical transmission are rapidly changing, so specialist advice is essential. Breastfeeding is discouraged due to the risk of postnatal transmission. Infrequent adverse effects include oral ulceration and hypertriglyceridemia. Rare effects include raised liver enzymes, lymphopenia, Stevens-Johnson syndrome, and toxic epidermal necrolysis. Common adverse effects include hypersensitivity to Abacavir, occurring in at least 5% of patients, usually in the first 6 weeks. It's more common in white people and associated with the HLA-B*5701 allele. Symptoms include fever, GI symptoms like nausea, vomiting, diarrhea, abdominal pain, rash, lethargy, malaise, myalgia, and arthralgia. Respiratory symptoms such as dyspnea, sore throat, cough, and abnormal chest X-ray occur in about 20%. Rarely, adult respiratory distress syndrome and respiratory failure can occur. Fatalities have occurred on rechallenge. Patients must be told to stop Abacavir and report symptoms immediately, and any remaining medication should be retrieved. For adults, the oral dosage is 300 mg twice daily or 600 mg once daily. For mild hepatic impairment, it's 200 mg twice daily. For children, tablet dosages vary by weight: over 25 kg, 300 mg twice daily or 600 mg once daily. For 20 to 25 kilograms, 150 milligrams in the morning and 300 milligrams in the evening, or 450 milligrams once daily. For 14 to 20 kilograms, 150 milligrams twice daily, or 300 milligrams once daily. Oral liquid for 3 months to 25 kilograms is initially 8 milligrams per kilogram twice daily, then 16 milligrams per kilogram once daily up to 600 milligrams daily. Patients must stop taking this medication and tell their doctor immediately if they develop fever, nausea, vomiting, diarrhea, abdominal pain, rash, unusual tiredness, or respiratory symptoms. If these symptoms develop, they must not take any product containing Abacavir again. Sometimes this medicine can cause lactic acid to build up in your body. Tell your doctor immediately if you have nausea, vomiting, stomach pain, fatigue, or weakness. If considering restarting Abacavir, check for the HLA-B*5701 allele and previous hypersensitivity symptoms, as life-threatening reactions have occurred. Measure lactate concentration if there is unexplained nausea, anorexia, vomiting, raised liver function tests, or hepatomegaly. Stop treatment immediately if lactic acidosis develops or if hyperlactatemia is accompanied by nausea, fatigue, fever, weight loss, abdominal pain, breathlessness, ascending neuromuscular weakness, hepatomegaly, or elevated liver enzymes. If you have not yet subscribed to my channel, do so now, like the video, and share it with a friend. Let's grow together, learn, revise, and succeed.